Laser lipolysis you can use basically anywhere you do lipo. Some of the areas where it's really excellent is in the neck, which I do my own procedure I call a shrink lift, where I do lipo of the neck, first tumescent, do lipo. I can go in with the laser and affect a lot more shrinkage and less induration and swelling post-op. The next day they'll see a major tightening over when I just did lipo. So I love it in the neck. I'll do it, of course, upper and lower abdomen. You get increased skin shrinkage, skin tightening, in addition to what you get with liposuction alone. Okay? The second issue that I think is the most important issue, because anybody under 40 might not need the skin tightening as much, okay, is you get what I called thermal wound conversion due to the laser. And instead of the battlefield injury associated with liposuction, we're ripping and tearing like a gunshot wound. It changes with the heating and the laser under there. It really changes the cascade of healing. So you get less pain, induration, less bruising, and you get people back to work in a couple days or a few days rather than a week or two. And they only wear the garment maybe 2 weeks instead of 6 weeks with liposuction alone. The idealized patient would be one who comes in who's in pretty good shape and has stubborn pockets of fat. A little blip here, some fat blips of the upper arms, a little blip of the tummy, blip of the love handles, outer inner thighs, inner knees. Great case. They're already in good shape, not hypertensive, diabetic, etc., etc. They're ideal because you know their lifestyle is already somewhat controlled. They're on what they take in nutritionally, they burn off every day. Okay? That would be idealized because, as I'll say the mantra, liposuction and laser lipolysis is not for the treatment of obesity. It's for stubborn areas of fat. They just can't seem to get off, but they're in pretty good shape otherwise. That's your ideal patient. Maybe they're 20, 30 pounds overweight.